Now, 34 may seem young for these cosmetic fixes, but according to the American Society of Plastic Surgeons, the majority of cosmetic patients are only 35 to 50 years old. Nearly 3 million men and women in that age group got some work done last year. The most popular surgical procedures were liposuction and breast augmentation, followed by eyelid surgery, breast reduction, and nose reshaping. We want to hear your questions about looking younger longer, so you can call us at 1-800-807-2620, or you can email us at housecall@cnn.com. To help answer your questions, we've got Dr. Marc Yune with us. Dr. Yune is a plastic surgeon here in the Atlanta area and a spokesman for the American Academy of Facial, Plastic, and Reconstructive Surgery. Let's get started. A lot of people have questions for Dr. Yune, a lot of emails. The first email is from Susan in Texas, who writes, I've been told the cosmetic procedures done in your 30s, such as reducing a sagging chin, are less invasive and more effective than waiting until one's 50s. Is that true? What do you think, Dr. Yune?
Well, that's an excellent question. More younger people are coming toward plastic surgery because it's been proven to be safer with modern techniques and predictability. So really it has to do with, it's a subjective call. A patient coming to me in their 30s who's very satisfied with the results probably shouldn't do that much work. But if they want an improvement, you're getting to appreciate it earlier in that point of life. And the skin's elasticity is better, so what you do tends to last longer.
If you start doing little things in your 30s, will that save you the big facelift when you're 60?
Not necessarily, but it helps you make you look better earlier again, so you get to appreciate minor aesthetic enhancements. The thing it does do is it avoids that sort of drastic change of going from having had no work done to a lift with other ancillary procedures. So.
Well, we have a phone call now from Donna in Florida. Donna, go ahead with your question for Dr. Yune.
Yes, Dr. Yune. My question this morning is that I'm very, very fair, and I noticed that any kind of cut or anything on my skin, the redness stays for a very, very long time, like sometimes up to a year, depending on how severe it is. And I'm wondering if I do something even as minimally invasive as dermabrasion or even Botox, anything that pierces the skin, what should I expect? I'm a little nervous about doing this.
That's an excellent question, Donna. Let me ask you, after the pinkness lasts for a year, does it go away or do you develop a thickened scar?
Actually, I sometimes develop a thickened scar.
You do develop a thickening to the scar?
Yes. It's not severe, but there is a slight thickening.
Have you had any treatments for it?
No, I haven't.
Okay. There is a handful of individuals, it's rare in a fair-skinned individual to develop hypertrophic or thickening to scars, and that can be treated. There are typical methods to treat that with steroid taping, steroid injections, but that is your immune system's response to an injury, so that's an excellent point, and you do need to be very cautious. When we do resurfacing techniques or surgical techniques, we always want to find out an individual's scarring history. So you need to bring that up to whoever you speak with about your concerns. They may not want to opt for any elective procedures.
We have an email now from Sunny in Massachusetts who wants to know, I'm in my mid-50s and have a couple of deep smile lines. Unfortunately, those lines make me appear to look older. Is there a way to minimize those lines without plastic surgery? That's a question I know I've heard all the time, Dr. Yune. People might not want to go under the knife. They want to try something else.
And that's the hottest trend in plastic surgery today, to do minimal, no downtime procedures. So in order to address that issue, that's probably the hottest research topic now in cosmetic medicine, and that's injectable fillers. Injectable fillers are taking a product and actually injecting it to fill out a deep crease, just like she was describing with a smile line. So what that's doing in essence is making you look more youthful, and it's taking away a shadow effect, a saddened appearance, what have you. Injectable fillers are numerous nowadays. Not all of them are FDA approved yet. So we do have a handful of safe materials. And then we also have some permanent implants. I actually brought one along with me today because what ends up happening is, for those who are very conservative, they'll start with an injection. Collagen, there are human forms of collagen. They all are typically non-permanent, but it gives them a chance to sort of try it on, if you will. And then what happens is, if they elect to have permanent correction, we can use implants. So this is what I brought along today, Elizabeth, to show you. This is a soft, it's a synthetic form of polytetrafluoroethylene, the same compound that's used in Gore-Tex, but it's made much more soft now and spongy. So
that would go under the skin, for example, right here.
It does.
To get rid of that line.
Under the fold, so that you push the fold out, it gets rid of the deepened look, a little bit of aging, and it's also used for thinning of the lips. So that's the, this is the material here, and it is sort of like the equivalent of permanent collagen.
Well, we'll be talking about more of these approaches to looking younger, and we'll be talking about whether or not they work and whether or not they're safe, and not just in the doctor's office, but also at the cosmetic counter. What's on the horizon when it comes to fighting those wrinkles, and where do you have to go to get it? We'll answer those questions and more. Give us a call at 1-800-807-2620 or email us at housecall@cnn.com. But first, let's check our Daily Dose Health Quiz. What is the most popular cosmetic procedure for people ages 35 to 64? That answer when we come back. Stay with us.